Hi, my name is Lanessa Zuniga. I'm a general pediatrician and a student at the University of Houston, currently pursuing my master's in education in health sciences. For my capstone project, I chose to evaluate and hopefully improve the resident training environment by applying a well-known burnout framework to residency. Many thanks to my advisor for this project, Dr. Robert Hausman. To introduce this project to you, first we'll discuss the problem and rationale behind choosing this project, and then I'll talk a little bit about the setting and the context in which this occurred. We'll introduce the project goals and objectives, and then discuss the results and next steps. Resident burnout is a well-known problem, and in a recent study of pediatric residents across 11 programs, the burnout rate was found to be near 40%. Though it has been established as a major issue that affects not only resident well-being, but also their interactions with patients and their education, there is limited data on effective interventions. It has been advocated that there not only be targeted burnout interventions at the individual level, but also to the system as a whole. Prior to beginning this project, I thought it was important to gather data from our institution as well. In the academic year 2016 to 2017, approximately 30% of our upper level residents scored positive for burnout, with high scores in both emotional exhaustion and depersonalization on the MBI scales. In an informal survey conducted by the chief residents that same year, 83% of the residents, out of a total of 101 responses, endorsed feelings of burnout during residency, and 72% endorsed feelings of burnout during that current academic year. There are many contributing factors to burnout, and research thus far has been mixed on whether or not there is one intervention that is truly efficacious. In 2017, JAMA released an article that advocated for organizational instead of individual interventions for burnout. So what comes next? I turn to the expert and leader in the field of burnout, Dr. Christina Maslach. Not only did she develop one of the most commonly used methods to assess for burnout, the MBI scales, but she also developed a framework that identified organizational predictors of burnout in the workplace, called the areas of work life. This framework looked at the work environment to see what could be done to promote productivity and engagement as a means of combating burnout. This led to the identification of 6 areas within the work environment that can affect burnout. In my mind, there was a link here to education, to helping residents achieve the necessary milestones to becoming a good pediatrician and being engaged in the training process during residency. The framework argues that these 6 areas affect burnout in the work environment, which in turn also impacts job satisfaction and performance. In residency, the environment is one in which both work and learning occur simultaneously. Burnout in residency thus not only affects satisfaction, but also inherently resident performance through education. In its essence, this framework argues that optimizing the 6 identified areas will lead to employees that perform better and have higher job satisfaction. Extrapolating from that, optimization of these areas in residency, mitigating burnout and enhancing education, will improve satisfaction and performance. So while the work-life theory was created as a general theory and not specific to healthcare or residency, it had the potential to be applied to our environment and make a difference in burnout and education. After looking at these areas, we asked ourselves, what does it mean to residents to have control? What do they value? As residency is a unique blend of work and education, the answers were not clear. This led to the development of our project. The goal was twofold. First, we needed to understand what these domains meant to the residents, what their perceptions of them were. Secondly, we needed to identify gaps within these areas at our own institution. Conduct a needs assessment, if you will, to better inform the development of future interventions and curricula. So when thinking about our goals and objectives for this project, Our overall goal was to understand how Maslach's areas of work life applied in the context of residency, and we really wanted to use this framework to identify areas of improvement to guide interventions and improve not only burnout, but also education. The objectives were to better understand and define the work-life domains in the context of residency, to identify specific gaps within the work-life areas, and to begin to formulate strategies for potential interventions to decrease burnout and improve education. The resident training environment is complex and usually exists within hospitals and clinics, not to mention training that takes place in research, mentorship, community advocacy, and so forth. While the results of this project will be most useful to individuals involved in residency program leadership and those involved in the development of resident educational materials and curricula, all individuals that participate in resident training, either formally or informally, will benefit from these findings. Furthermore, even administration, while not directly involved in resident education, has a great influence on the resident environment and could aid in the implementation of meaningful changes based on these findings. In order to truly gain the perspective of the residents, I thought it best to conduct one-on-one interviews. The data from those interviews would then be used qualitatively to answer our two questions. First, how can we apply these work-life areas in the context of residency? And second, which areas at our institution have gaps that should be targeted for interventions? For question development, we used appreciative inquiry and decided to have the questions be as open-ended as possible to truly capture the residents' thoughts and perceptions. We interviewed residents until we began to identify consistent themes and had a total of about 15 interviews at the end of our study. Each interview was recorded and then anonymously transcribed and coded in an iterative fashion. So what did we find? Listed here are the different themes identified for the individual areas in Maslach's work-life theory. In the control domain, we found that control to residents meant autonomy, and this came in two different fashions: autonomy in making patient care decisions and autonomy in controlling one's schedule and one's time. When asked what residents valued most, the answer was overwhelmingly education, specifically through patient care. They stressed the importance of learning from patient interactions and being involved in patient care as a means of education. When asked what was rewarding to residents, they identified both extrinsic and intrinsic rewards. Extrinsic reward came in the way of positive feedback and small acts of kindness, like attendings bringing breakfast to work. Intrinsically, they described that meaningful experiences with patients were extremely rewarding. When it came to fairness, resident answers mainly focused around their schedule and ensuring equal treatment, such as same number of days off for all residents. When asked about their community, they overall described their relationships as positive, though desired more interactions with advanced practice providers and nurses. The most important takeaway from the community aspect, however, was that the residents identified each other as their main support system. For workload, residents stressed the importance of recovery time and how necessary it was to have some downtime between difficult rotations and even during rotations just to recharge. They also discussed how non-educational tasks often contributed to the perception of high workload, while tasks that related directly to education or patient care, even if time-consuming and emotionally charged, seemed to lessen the workload. In reviewing the resident perceptions of the work-life domains more closely, what we found was that several of the work-life areas, specifically control, reward, values, and workload, could be linked back to patient care. For example, residents most valued education through patient care and identified the intrinsic reward of being able to meaningfully participate in the care of patients. Thus, emphasizing patient care throughout the residency curriculum could have a very large impact on burnout. This is consistent with previous work that has been done linking time spent with patients, as opposed to time spent at the computer writing notes, for example, to work satisfaction and resident ability to find meaning in their work. Lastly, community was found to be linked to all areas and is a notable target for burnout interventions. So, how can we use this information moving forward? Currently, there are several initiatives underway. However, the most notable is the redesign of our noon conference curriculum. This consists of a 1-hour daily lecture to the residents over pediatric topics based on competencies identified by the American Board of Pediatrics. There has been no further guidance in the past to presenters, aside from the list of topics, on how this instruction should be delivered. Utilizing this framework and findings from our research, we plan to incorporate more resident-related patient care experiences into these noon conferences. We hope to have patients actually come to the conference. We're going to encourage resident reflection on impactful patient experiences and even provide more opportunities for the residents to interact with and learn from each other. Doing this will improve the domains of control, values, reward, and community, hopefully have an impact on burnout, and ideally improve our residents' educational experience. It is my opinion that this framework can be used moving forward to better the resident educational experience and to improve burnout. And before I conclude this presentation, I just want to say thank you to all of my teachers and advisors in the Masters of Education in Health Sciences program. Without the tools and knowledge that I learned in this program, I wouldn't be able to make such a difference in the future of resident education. And for that, I am very appreciative and very grateful. Thank you.